Hi, this is Dr. Abdul Ahad Khan, specialist orthopedic surgeon, speaking from CarePoint Medical Center, Ras Al Khaimah. Today, I would like to discuss a role of diet, fasting, and exercises in the management of musculoskeletal pain. These days, we are getting majority of our patients having neck pain, back pain, knee pain, shoulder pain, multiple joint pains. Before we start their treatment with the help of medicines and other modalities available, I would speak on the role of diet in the management of these problems. These days, majority of us are consuming diet full of fructose and omega-6, which is highly inflammatory. If you do not switch over to a diet which is less of these compounds, any kind of treatment will fail. Majority of us using a lot of soft drinks full of fructose. Fructose is very inflammatory. It adversely affects the immune system. Fructose is causing issues. It has a unique metabolism. It is not going into blood. It is metabolized by liver. Fructose is converted into glycogen. It is stored in liver. It becomes uric acid. It becomes bad cholesterol. And it gives you fatty liver. It is very inflammatory. Omega-6, if you see our body, we are consuming these days, if you see all these vegetable oils, they are the sources of omega-6. If you do not stop these things, treatment will not help you. A lot of people, they are coming to us, they're taking plenty of non-steroidal anti-inflammatory drugs, and there's no change in the diet. Today you take one painkiller, and the next 1 hour you go for a soft drink. There's no effect. So with this standard American diet, which is full of fructose and omega-6, you're consuming a lot of non-steroidal anti-inflammatory drugs, which will ultimately affect your kidney, and you are going to land up with dialysis, not improvement in your pain score. So this is one issue, that we have to change our diet. We have to use a diet which has less fructose and less omega-6. Fruits are sources of fructose. All soft drinks, fruit juices, dates, honey, rice, this is all fructose, sugar. You have to stop all these things before you switch over to any definitive treatment. Second thing, the most important thing is, it is not only that you have to stop all these things. Our body is designed like this, that there's a window for feasting and there's a window for fasting. You have to feast and then give a big window, a larger window for fasting, like 8 hours feasting, and then you have to have 16-hour fasting. Fasting is the only available modality to address insulin resistance. Each one of us, whether the patient belongs to orthopedics in the form of joint pains, or to heart, or to brain, everywhere you will see the pathology behind it is insulin resistance. With insulin resistance, you are in a continuous state of inflammation. Insulin resistance can be tackled with fasting. You have to have a fasting with a feasting of low carbohydrate diet. It is very, very effective, and it will sensitize all the insulin and everything in your body. The last thing is exercise. Exercises, if they are done on a basis with a proper understanding of exercises, they are helping you. If somebody has a very severe pain in the knee, with the acute inflammatory response and the knee is acute inflammatory state. If this patient goes for walking for 2 kilometers, 3 kilometers, or go for cycling or go for any kind of hectic workup, the problem is going to increase. It is not going to solve your problems. Problem will be solved only when this inflammation subsides with the help of proper modalities, and then you go for rehabilitation programs. And you have to understand that exercises is a very, very intelligent program. You cannot pick anything without any advice. I will advise very strongly, especially to knee patients, that they are supposed to do exercises to improve their gait. They have to change their footwear. They have to do exercises around ankle. They have to do exercises strengthening their hip muscles. I will recommend a very strong protocol. Recently, there's a website known as Knee Over the Toes Guy. You go to his sites, he'll explain you certain kinds of exercises, and you will feel much better with these kinds of changes. And of course, from orthopedic sides, we have pain managements, we have a lot of injections starting from viscosupplementation or PRP therapy or prolotherapy. We are doing a lot of things around knee, but these things are very, very important. Thank you very much.